Welcome to your health channel on YouTube. Today we will talk about a topic that can be key for those facing hypertension problems. Enalapril Maleate in its 20 mg presentation. What is it for? How does it work? And, most importantly, what should you know before taking it? Stay until the end, because this information could improve your quality of life. Enalapril Maleate is a drug belonging to the ACEI group, which stands for angiotensin-converting enzyme inhibitors. Its main function is to control high blood pressure. It does this by relaxing the blood vessels and facilitating blood flow. This reduces the burden on the heart and prevents serious complications such as strokes, heart attacks, and kidney failure. This medication works by inhibiting a specific enzyme that normally causes blood vessels to narrow. By blocking this enzyme, enalapril allows vessels to dilate, reducing blood pressure and improving circulation. Enalapril Maleate is mainly prescribed in cases of persistent arterial hypertension, especially when it cannot be controlled with natural measures such as diet or exercise. It is also used in patients with heart failure because it helps the heart to work with less effort, and to prevent complications in people with diabetes who are at risk of kidney damage. The usual dose of enalapril Maleate is 20 mg per day, although it may vary depending on the doctor's instructions. It can be taken once or twice a day. It depends on each case. Patients are often unaware that it is absorbed much better if taken with food, such as breakfast or dinner. Also, like any medication, enalapril can have side effects. The most common ones include dizziness, especially at the beginning of treatment, persistent dry cough, which although not dangerous, can be annoying. And in rare cases, it can cause allergic reactions or affect kidney function. Avoid combining this medication with alcohol, as both can lower blood pressure too much, causing fainting. In addition, enalapril should not be used during pregnancy or breastfeeding. If you are taking other medications, such as diuretics or antidepressants, tell your doctor, as they may interact with enalapril. Remember that enalapril works best when combined with a healthy lifestyle. Maintain a healthy weight, reduce salt and carbohydrate intake, exercise regularly, avoid smoking and limit alcohol. Remember that this medication must be prescribed by a doctor. Never self-medicate, and if you have any doubts, consult a health professional. Yes, I have answered your question. Don't forget to give it a like and subscribe so you don't miss any video. Your help allows us to reach more people. If you have any questions or would like to make a query, you can leave a comment and we will gladly respond. Thank you for your attention, and see you next time.